So, welcome to Shelterforce's webinar on getting to more affordable and accessible housing. This is a topic that is near and dear to many people's hearts, and we have a lot of people signed up for the webinar today, and appreciate your being here. So, my name is Miriam Axel-Lute. I'm the editor-in-chief at Shelterforce. If you're not familiar with Shelterforce, we're a national publication, national nonprofit publication that focuses on affordable housing and community development and anything it takes to build thriving communities where everyone has a place to call home. Last year, we published one of our Under the Lens series where we take a particular topic and we dive deep into it and do a series of articles around that on disability and housing justice. It was something that we'd been hearing from our readers that we wanted to get into more, and also knew that many of our readers weren't as connected in with the disability and justice community as perhaps they might need to be or want to be. So we published that last year, and we're following up now with a webinar conversation with several people who participated in that series in different ways. And we're going to have a good, meaty conversation today about what we need to do and how we can get to a place where there's a better round of affordable housing and accessible housing for all. So I gave you my name, but again, Miriam Axel-Lute, editor-in-chief at Shelterforce. My pronouns are she, her. I'm a middle-aged woman with curly dark hair with a streak of gray in the front and purple pointy glasses. When each of our panelists answers their first question, they will also give us an introduction to themselves. And we're going to start just with some context setting. So what is the state of affordable, accessible housing today? We're going to start with Shelley. Shelley, after you introduce yourself, can you start us off talking a little bit about how affordability and accessibility interact with each other?
Yes, thank you. My name is Shelley Richardson. I'm the executive director of the statewide Rehabilitation Council of Illinois. My pronouns are she, her. I'm coming to you from Springfield, Illinois. I am in my work office. I'm a middle-aged white female with red hair and glasses, and I'm wearing a blue top today. Before I came to the executive director position here, I worked for a Center for Independent Living in Alton, Illinois, that's St. Louis metropolitan area. And I transitioned people out of nursing homes or institutions into community living. The greatest barrier to transferring these people out of nursing homes was finding affordable housing. I was glad that I had the personal experience with affordable housing because I was able to utilize what was then called a Section 8 voucher while I was getting my education and raising as a single parent my twin daughters. So I knew how important that type of housing was. The problem that we had is finding there are many builders that are building for what they consider low income people, but the people that I worked with were usually only on SSI income. And because I'm low vision, I'm going to be using my magnifying glass and looking down so I can get my numbers right. But starting January in 2024 this year, the maximum monthly income for those that are on SSI was $943 a month. Now, as you can imagine, these people coming out of nursing facilities with only $943 a month to cover everything, they need what's called extremely low income housing. And that's people that make below 30% of the average median income. Those units are very hard to find because there's not enough builders out there that are building those units. So it's a real big need. And then when you try to find accessible units, then that just narrows that very, very much smaller. And I want to give you some statistics for the state of Illinois. Now, right now, and the statistic I'm referencing comes from the National Low Income Housing Coalition, and a link to their organization will be in your chat, and you can get all your state statistics from them. They've already done the research. But right now, in the state of Illinois, we have 443,746 renter households that are extremely low income. Now, that doesn't count the people that are on the streets right now that are not being counted in that. And with that being said, that means there's also a lot of people that are paying more than they should for their rent, and they're foregoing necessities because they're just trying to keep a roof over their head. And so, according to that number, we have a deficit in the state of Illinois of 293,354 units for extremely low income people. And like I said, let's keep in mind that that does not count the people that are on the streets right now that are not being counted in the statistics. So that's the biggest hurdle that I face. That's where I see the need is. And yeah, I'll yield it back to you.
Sure, Shelley, just a quick follow-up on that,
Mhm.
along with, as if it wasn't enough, the challenge of finding units that are affordable and accessible. Just tell us very briefly about the challenge that some people face with having their services and their housing reliant on each other.
Well, it's going to go into another question that you're asking later, but I'll briefly touch on it here. People need to live in areas where a personal assistant can get to them to come in and help them with their activities of daily living. And if they're not close to transportation, sometimes personal assistants take that type of transportation to get there. And so it limits where they can live. Also, if they're in a rural area that doesn't have food and they can't get food delivery, or they can't get out and they're in a food desert, that's unacceptable. They need to be near medical care. If they are and I have my nightmare stories that I'm working on right now about people not being able to access transportation in rural areas just to get to their medical appointments. And oftentimes, if a person is placed in an extremely low income unit in an area that they can't get their critical supports, they end up being reinstitutionalized all over again just so that they can get their needs met. And we don't want to see that happen. We know that people thrive when they're living within their own community, among their loved ones, with their services, and paying back into their local economy.
Thank you. Anita, we're going to move to you next. Can you tell us just a little bit about some of the effects on disabled people who cannot get housing that is accessible to them and how it affects different groups differently?
Hi, I'm Anita Cameron. I am Director of Minority Outreach for Not Dead Yet. It's a national disability organization that fights assisted suicide. My pronouns are she, her, hers. I am a Black woman with caramel-colored skin, long locks, black headphones, a pink T-shirt with black lettering that says "Not Dead Yet." Well, effects on people who can't get housing. It can be horrific, to say the least. Other than living on the streets and being vulnerable to injury, or illness, and the possibility of winding up in an institution. Often, it's been my experience that people with disabilities, especially, can't find housing. It leads to depression. It leads to, obviously, to anxiety. It leads to feelings of worthlessness. When you have other identities on there, when you have racial, when you're marginalized, um, you know, racism, or you are someone who is disabled and you have probably a felony conviction, which means you can't get um, that housing in a lot of states. Uh, that leads to that can lead to you um, being forced to do the things that you did to survive, leading once again to reincarceration. There's there's another um, uh, situation. Um, so I am in Rochester, New York. Rochester, New York is 85 miles from the Canadian border. And so we see often what happens in Canada to people with disabilities, and their system is horrific. And Canada has um, what they has assisted suicide and euthanasia, what they call medical aid and dying. And what we found um, in Canada is that disabled people, and there are a number of high profile cases, um, disabled people who cannot find um, safe, affordable, accessible housing are now choosing to die via assisted suicide. And it is happening quite often. In fact, people with disabilities who can't afford the costs of being disabled, who can't get medical treatment for their disabilities, are choosing to die. And so the housing situation is particularly egregious. And then look at the situation here in the United States. That also leads to feelings of despair so terrible that you choose to take your own life, that you choose to die by suicide because you're not safe. You don't feel safe. There is no safe housing. There is no affordable, accessible housing. Often, people who can't find that, certainly here in the United States, with a disability, also wind up institutionalized back in a nursing home. Often, the only reason that people are stuck in nursing homes is because of the lack of housing. And sometimes people who've been uh, in housing but then lose access to it or whatnot wind up back institutionalized. So thank you.
Thank you. Hunter, so at the Kelsey, where you work, the Kelsey talks frequently about housing that is affordable, accessible, and inclusive. And so talk about why the inclusive part is necessary to specify in there.
Thank you. Hi, everybody. My name is Hunter Herrera McFarland. I work at the Kelsey, and we are both a national housing developer of, what Miriam just said, affordable, accessible, and inclusive housing. But we also change policies at the local, state, and federal level to make, what we call disability forward housing the norm across the country. I'm a multiply disabled individual. I am a light-skinned Indigenous woman. I'm wearing a dark green turtleneck and black thick rimmed glasses. My hair is up in a ponytail. My background is mostly white walls, but I have a plant and a painting as well. So we all know in this room that the past deeply informs the present. So the affordable housing crisis is a direct result of, racist, ableist housing policies and practices that redline and segregated communities of color, and then also denied people with disabilities the fundamental right of community living, placing us in institutions, hospitals, congregate settings, which we all know are the least inclusive settings possible. And even though people with disabilities have had the legal right to community living for almost 25 years under the Olmsted Supreme Court ruling, people are still not able to move into these communities and housing of their choice because, the supply just does not exist. And my fellow panelists covered this point really well, but I'll add a couple of statistics. So We know that there are still roughly 1.2 million adults living in nursing homes, which includes, people under the age of 65 that live in nursing homes just because it's the only affordable or accessible place for them. And there's more than 360,000 people in psychiatric facilities and more than 260,000 people with intellectual and developmental disabilities who live in congregate or institutional settings, or they're just simply on wait lists for services and residential programs. So they live with their family members instead. And there is actually about only 12% of people with intellectual and developmental disabilities who own or rent their own homes. So this is a very low percentage and probably doesn't, and it definitely doesn't reflect what people want, which is to own or rent their own home and live independently. So in survey after survey, when older adults and people with disabilities are asked where they would prefer to live, they say they want to live in their communities and not in these institutions. And we saw, during COVID that these institutions are not safe either for a lot of people, but especially people who have compromised immune systems or chronic illnesses. And then also just countless studies have shown that people are also happier and healthier when they live in community settings and have independence to make, everyday choices that a lot of people take for granted, like choosing what they want to eat for lunch that day or choosing what hobbies they want to engage in, or even having people over to visit them. They usually have to go through a lot of bureaucratic processes just to have those basic things that we, have every day already. And so community-based housing is not only good for people, but it's also more cost effective compared to when people are relegated to live in institutional settings. I don't have the exact numbers in front of me right now, but it's congregate settings, institutions are far more expensive than paying for like a live-in aid, for example. And inclusion to me is really not just about living in the community of my choosing, but also making sure that I'm able to thrive there. So I want my cultural background and personal experiences to be valued and really to find support from my neighbors. And that is really the kind of community we thrive for at the Kelsey. I'll talk about the model that we kind of have to get there if I have time a little bit later. But yeah, we really think that at the Kelsey, it's not just about integration, it's about inclusion. So making sure that you feel like you're a valued member in your communities and in the buildings that you choose to call home.
Thank you, Hunter. I just wanted to say to everybody tuning in, if you have questions and you want to put them in the chat, we will be watching that and we will be bringing your questions to the panelists at the end of the time. So definitely put your questions in there, comments, whatever you wish. We will also be sharing a transcript of the chat with everyone who registered. So if you're not, don't worry if that you would miss something that's going on there. Chelsea, I want to turn to you. Our series was called Not Just Ramps in Shelterforce, trying to give a nod to the fact that different folks need different kinds of accessibility accommodations. And how much is or isn't that recognized when we discuss affordable housing usually?
Yeah, sure. Happy to weigh in on that. Everyone, I am Chelsea Hayman. My pronouns are they, them, and I am a white woman with gold-rimmed glasses and dirty brown hair. And yeah, I'm happy to join everyone today. I work for the state of Maryland. I was formerly with the Department of Disabilities as their Housing Policy and Programs Director. I'm now with the Department of Housing and Community Development, serving as their Senior Federal Compliance Analyst. In my role with the Department of Disabilities, I did extensive housing policy analysis, but our agency also administers the HUD Section 811 Project Rental Assistance Program and other housing programs for the state that are specifically intended to benefit people with disabilities coming out of institutional settings. And as we all know, disability is broad. Disability looks different for different people, and therefore accommodations are very different for different people as well. The biggest tool that states have in order to indicate priorities around how they handle accessibility being built into housing is going to come through the state's qualified allocation plan for low-income housing tax credits. So that guide is often used as a policy tool in order to indicate what types of developments the state would like to fund in order to create integrated and sustainable communities. It's a lot of different aspects covered within one document. So disability is covered within that document. Typically, just to give you an example, that is an opportunity for advocates and also other state entities to weigh in and say, we have specific priorities that we want to see showing up in this plan. One of the things that came out of our last iteration of the qualified allocation plan in Maryland is an actual definition of what universal design means. And that has very specific aspects covered in that. So instead of universal design conceptually being mentioned in the plan, the specifics around where the outlets should be placed, what types of door handles should be used, things like that are now detailed in that document. So the consequences of leaving that technical information out is that you're not going to be able to capture the broad aspect of making sure that a modification is made to a unit, perhaps even before somebody moves into the unit, right? So that's one aspect of it. I would say also the need to consider different types of accommodations specifically, so changes in program policies and procedures. It's going to look very broad depending on the person. There are even situations where we had residents in our 811 program who had different types of limitations to scent and smell, where there was environmental pollutants that were going to trigger that individual, and therefore they would need to request an accommodation. And we had a policy in place where they were able to do that through our tenant selection plan. All of the programs, 811 programs, have to have an accommodations policy, and those accommodations are reviewed on a case-by-case basis. So without having a plan like that, without having documents like that in place, it does a disservice to the individual because their needs are not truly being met by the housing that they're living in. So it is very important to have very clear policies and procedures to ensure that we're providing the highest quality integrated housing that we're able to provide.
Thanks, Stephanie. I would like us to move on then to talking a little bit about what developers who want to do better on accessibility should keep in mind. So there's a lot of developers of affordable housing out there who might want to do better at this, but don't necessarily know where to start or are afraid that it's too expensive. And so we're going to turn to you, Hunter, to just give us a little bit of an overview of how you approach designing a disability forward building from the technical side. And I know you guys have a lot of resources to follow up with.
Yeah, definitely. So we know at the Kelsey that code compliance is critically important to developers, not just to make sure that they don't have costly, unforeseen costs down the road, but they also need to go beyond code compliance because a lot of these codes are outdated, like for example, the Uniform Federal Accessibility Standards, which a lot of buildings have to follow if they get federal funding. That hasn't been updated since the 80s. So there's a lot of new innovations, a lot of new learnings through the design that really need to be considered. And so that's why the Kelsey, created the inclusive design standards, which we, define as, for cross disability access, meaning designing for all types of disabilities, not just physical and sensory disabilities, but also cognitive disabilities for individuals who have intellectual or developmental disabilities. And so we did this in partnership with architectural firms and also created the Inclusive Design Council to really help us figure out how to do this correctly. And then also community engagement as well around this to see what people were really looking for in their buildings to feel at home. And so not just for physical access, but for other types of access. So our inclusive design standards include over 300 different elements, and they reflect both design choices, building features, development strategies. So making sure that you're engaged in community development or community engagement during the pre-development phase, and then operational policies as well that support accessibility and inclusion. And these are really innovations in architecture and planning that take into account a much broader spectrum of human experience. And they're downloadable at thekelsey.org/design. And there are 6 impact areas that are included. And these are based on what different people with different disabilities would need to thrive in their home. So mobility and height for physical access needs, hearing and acoustic for sensory access needs, vision for people who are blind or low vision, health and wellness, which everyone in the building will benefit from, but especially people with chronic illnesses. So we make sure that the design or the building elements that we use, have the highest grade for environmental impact, but this also helps people who have chemical sensitivities as well. And then cognitive access for people with intellectual or developmental disabilities, but these also help other people like young children. So an example that we include that I'll add is sensory gardens, which add beauty as well as utility to buildings. And then there's also wayfinding, which will benefit young children who need to find their unit. And we also in our building designs, like I said, we make it easier for people sensitive to a lot of noises. So by exceeding requirements for sound transmission class, you create a better home for people overall, and it has the added benefit of less confrontation about noise between neighbors. And the final impact area is support needs, which at the Kelsey we think this is critically important and is largely left out of a lot of developments. And it's really for everyone who needs assistance to live independently. We need to dismantle the myth that only some people with disabilities can live in the community, because we know that all people can live in the community, ranging from people who need 2 hours a week of support to 24 hours a day of support. We just need to create, the right systems and practices to make this possible. And one concern that developers have is that increased accessibility is too expensive. But we have found, we have 2 developments that are under construction, one in San Francisco and one in San Jose, one of the most expensive markets to build in the country. And when comparing the cost of our projects to citywide average costs for affordable low-income housing tax credit funded homes, the projects are cost competitive. Our one in San Jose is going to cost 2% below average, and the one in Civic Center in San Francisco will be 14% less than the average. And while we haven't built projects in other parts of the country yet, we have done, some high-level cost analysis between states that have, increased accessibility requirements in their LIHTC programs and those that don't. And it's really cost neutral. Like there's barely any difference at all. And if you build with accessibility in mind at the very beginning, it's not more expensive. What is expensive is not considering accessibility and having to make expensive modifications in your home. So at the Kelsey, all of our units are designed to be adaptable or accessible, meaning, if somebody with a disability is visiting your home, you can, you can take away very easily with a screwdriver the, underspace in the counter so they can use the counter. And so, we think that it's really important not just to design for people who currently live in the home, but also people who would like to come visit you. So the term, that the industry uses is visitability. Let's see. Yeah, I think those are the main things. modifications such as roll-in showers are expensive after project completion, and then are tricky to add later because they can lead to potential problems like water damage. So yeah, I think that it's just critically important that developers consider this from the beginning, and they can use the Kelsey's design standards to do so. San Jose and the District of Columbia, for example, incentivize using our design standards for LIHTC funded properties. And the Kelsey has like a self-scoring sheet that can really help you do this independently, but we can also work directly with you through our technical assistance to make this possible.
Thanks, Hunter. That's great. And I just want to re-emphasize that point about cost, because it is the thing that I think everybody is worried about. So Shelley, we were going to talk about transportation here, which you got started on earlier. If you want to say anything more about the transportation and transit connection before we go on.
Yes, thank you for asking. I was thinking back to one of the cases, one of the consumers I was working with to move out of the nursing home into the community. And I was registered on the 811 system, so I could go in and look at what units were available. But as also a friend, was friends with the lady that was at the time overseeing that list. And so she would call me from time to time when she had an opening, and she said, I have an opening in this unit and it's for extremely low income. And we're having a hard time filling it. Do you have anybody that could go there? And I said, well, okay, let me and Tiffany, who is my work partner, I said, let's go and we'll look at the unit. And when we got to the town and we saw where the unit was, there was no transportation coming to it. There was no supermarket close to it. It was in a very rural community. And so I called Lori back and I said, I can't use this unit because there's no way that my consumer can get the supports that they need. And I have been saying for so many years, I've been beating the drum over and over that I would love to see a partnership between the Department of Transportation and the housing industry, so that there is some way that they work together, that there is incentives either coming from Department of Transportation or going to Department of Transportation, added to the incentives to build near transportation or to bring transportation to the more rural areas so that people are able to live further out into the more rural communities. And as a personal experience, I will tell you that when I get in a place that is accessible to me, since I don't drive, I don't move. I don't move unless I have to, because that component is so important to me. So when I was living, I had moved to a bigger place in an apartment complex that was right on the bus route that would get me to work every day. And so I was unpacking and I had all these boxes around me and trying to get the furniture set up. And my mom come in the front door with the paper. She goes, read this. And it was an article that said that there were going to be several hundred housing vouchers cut from the program. And one of the programs was going to be the program that I was at. And also, and so I had to fight for the voucher to remain, and that became a national case because I called my legislators and things like that, and the AP network picked it up. So we were able to save some funding for that program. But then when I was getting into the place, when she brought in the paper said that they were cutting transportation the route that was right to that apartment building. And I sat down in the middle of the bedroom floor and started crying. And I thought, what am I going to do? Because I need this transportation to get to where I'm going. And so I started fighting and rallying other people, and we fought and we fought, and we kept the bus stop in the town that served where I was going to be living. So this is critical. Right now, personally, I just, my office moved, and I did live in an apartment building that was close to my office, but we moved our offices. And I looked, I had to take Uber every day. It was costing me a fortune. And I looked and looked. It was like finding a needle in a haystack. And finally, something opened up a block from my office. Do you think I'm going to move from this little house that I'm living in? No, it took me forever to find this. And now I can walk to work. So, making these units available to those of us with disabilities and accessibility to transportation and groceries and the things we need is vital. And I think that we sometimes get a bad rap. Well, I think they probably won't live there very long and they'll want to move. No, it's too hard for me to find a place. No, when I get somewhere that's accessible for me, I'm not going anywhere.
Absolutely. This is Miriam again, and thank you, Shelley. I want to now, and this has been a step, so talking about transportation is one step larger than the design of the building, to talk about the location of the building. But I also want to talk about things that are not about the physical building or necessarily the physical environment at all that affect accessibility, such as how one manages or distributes or connects people, communicates with folks when you're managing or developing affordable housing. And so we're going to go back to you, Hunter, a little bit and talk about what the Kelsey does differently in your buildings beyond the physical design, such as with your leases.
Yeah, thank you. We just launched last year our plain language leasing initiative. And we found, through some studies that many tenants with or without disabilities really face a lot of barriers to securing and maintaining housing due to just the lack of understanding of these really complex legal documents. And they're, not only used in lease up processes, but in income certification. This is an ongoing problem that it isn't just within the very beginning of securing a housing, but you usually have to do yearly. And this complex language can be really cumbersome for residents who have intellectual or developmental disabilities and are, intimidated to raise literacy, disability accommodations, or quality of living issues with their landlords. And we've been talking a lot about Section 811 in here, and it's such a critically important program, but we found that the lease that it uses that is approved by the Department of Housing and Urban Development is written at a graduate school level. And plain language for all audiences, geared towards audiences with cognitive disabilities, typically sits at the 5th or 6th grade reading level. So plain language is writing designed to ensure the reader understands documents as quickly, easily, and completely as possible. And so the Kelsey put together a diverse team of professionals to collaborate on translating and simplifying 6 commonly used affordable housing documents for practical use. And we've only done so in California, but we want to do it, in a lot of other places. And then also, landlords can use these documents in their state as long as they, review them with the lawyer to make sure that they have all the state level requirements that are necessary. And so you can, I believe the link was posted in the chat for that initiative, and the documents as well are up there on our website. And then something that we're also really proud of is how we achieve our goal of inclusivity through our inclusion concierge program. And this is really to make sure that housing and services are decoupled so that people with disabilities can make and choose the housing supports and services that they want, but it also ensures that people with support needs can maintain those housing services. So the Inclusion Concierge program coordinates between property management, maintenance staff, natural supports, and the partner agencies, formal supports. And we also make sure that this person, our inclusion concierge, works on social connectedness. They engage in thoughtful planning of what we call inclusion hours that are fully accessible, and really engages each resident to connect and experience the value and joy of living in community. And the inclusion concierge team receives, disability inclusive training, as well as training on service delivery, trauma informed care. And they really just kind of help to translate the principles of the resident experience through established pathways, including monthly check-ins with residents, They also, review the leasing agreements for inclusive language with the individuals and coordinate with community partners to identify and form circles of support, as well as just, basic things like making sure that people know where the grocery stores are, where they know where the nearest hospital is, things like that. And then we also have at the property in San Francisco, the very first of its kind. It's a city-funded disability cultural community center, and it's ran by community partners in the area, and it will host events for the greater community to enjoy, and then also offer resources to create a better resident experience, which will definitely lead to decreased unit turnover and improved health outcomes for everybody. So those are just a few of the things that we provide at the Kelsey, but we think are, the most important, and that could easily be modeled in every other community building.
Thank you so much, Hunter. Chelsea, I want to go to you now. One of your jobs in Maryland has been keeping an eye out for problematic legislation, things where a disability was not taken into account when laws were written. Can you give us a couple of examples of the kinds of things that come up and what better options you've suggested?
Yeah, sure, absolutely. So it really depends, but the main objective really is to take a look at what bills are being proposed at the start of legislative session and throughout legislative session, specifically to see where the impact might be when it comes to implementation of the Olmstead Act. How could this piece of legislation have an effect on the state's ability to effectively implement Olmstead and the community integration mandate that goes behind that act? So, as an example, one of the pieces of legislation that was interesting that came across my desk this past session was specific legislation that would have allowed changes to the wiretapping law, where someone could be able to record or use like some kind of recorded device in order to catch a landlord potentially being discriminatory against a person who has a disability over the phone. So normally that kind of transaction, because of how the way the wiretapping laws are written in our state, it's not allowed. You can't record someone without that consent first. But this would allow for fair housing testers who need to use a recorded device in order to capture or to get information about a housing opportunity to be able to catch that discrimination as it's occurring, right? So that's just one piece. Additionally, there are different kinds of incentives that could be proposed by legislators to build housing that is not integrated. So housing that is primarily one population instead of housing integrated for a person with a disability. Our agency does not subscribe to housing that is solely for one disability type or all individuals with disabilities. Our agency, because the Olmstead Act is a key part of our agency's mission, any incentives that would provide affordable housing developers the opportunity to build in excess of 50% disability units or 100% disability units. We want there to be intentionality in how that language is written. And sometimes it's not necessarily bad intentions. It's not realizing, it's not being linked into the community and not realizing that this is not helpful for this community. It's not how everything is being practiced right now. So it's catching little things like that. And it does really require you to kind of comb through very carefully and look and see what's out there and the undue impact that it could create.
Thanks, Chelsea. And one of the ways to catch unintended consequences is to make sure that you have the people who will be affected at the table. And I'd like Anita to come back and talk to us a little bit about being inclusive in the planning and designing process.
Hi, this is Anita. So you definitely have to be really inclusive. And I don't understand why it doesn't occur to folks who, hello, talk to people with disabilities. That's the first one you do it. You talk directly to us. If you're forming committees, commissions, things of that nature, have us on it. As a matter of fact, come to us. Don't wait for us to come to you, because often in our community, I mean, we're like, it kind of, many of us feel that you're not going to listen to us anyway. So why, why even bother? Or if we try to tell you something, you won't listen, you won't really hear us. So instead of waiting for us to come to you, come to us. Find us at our centers for independent living. Find us at, our local disability organizations. Find us at, at our disability organizations that don't have to do with medical or medical things. And find us at the places that we have fun in our community. I'll find us and get our input into your projects and get us in on the ground floor, because when you do, then you're going to, well, in the first place, you're not going to, you'll save money. You'll save money because people will tell you the most cost-effective ways to do things that are accessible and inclusive, of us. You won't have to go and redesign a program or change policy or whatnot, because you're going to have the ones of us most affected, the disability community, and look at it also from an intersectional point of view, because remember that disability isn't always the same. And so communities of color within the disability community, often face racism or further marginalization. If you are marginalized because you are a member of the LGBTQ community and whatnot, so it includes us. So when you get disabled people, you are very, very likely also including other communities as well, communities of color, seniors, young people. We in disability cover everything. So come to us. Don't be afraid to come to us, and don't approach us like we don't know what we're doing or what we're saying, because we do. We are the experts in our own disabilities and our own lived experience, and we can tell you things, that where you can avoid some of the normal pitfalls. So I'll stop right there. If anybody has any further, I'll elaborate further, but I think that's a good start.
Thank you. Yes, that is a key place to start. All right, we're going to go one more round with our panelists to talk about how we move forward to getting more affordable, accessible housing, and especially how we leverage the Olmsted decision, which has been referenced a couple times, which says that people with disabilities have the right to live in community, but they can't do that if they don't have housing that they can live in. And then we're going to go, I want to make sure to leave time for questions because you all have a lot of really great ones. So Chelsea, I'm going to go to you. You mentioned earlier putting rules into the low-income housing tax credit program about universal design and disability forward housing. I know that you've done some work also with incentives in other programs as well in Maryland, especially getting accessible units into old buildings and inclusionary housing programs. So tell us a little bit about that.
Yeah, absolutely. So it is really crucial particularly depending on what kind of state you live in. If you live in a state where there is a great concentration of urban counties or entitlement jurisdictions that receive direct funding from HUD to administer their housing programs, that you work and collaborate with those counties, particularly because those are generally the places where there is the most need and interest in housing, particularly due to the transportation access that those counties have, the jobs, the healthcare access, amenities of that nature. So in the interest of trying to meet some of the need that we were hearing a lot from people who are on our Section 811 waitlist registry, I made some critical partnerships with county leadership, particularly at Prince George's County, working with their county's Department of Housing and Community Development. They had established a right of first refusal program. And what that is it's a program that helps preserve naturally occurring affordable housing units. So big multifamily buildings that might go up for sale. And usually when the building goes up for sale, we know what happens next. The rents go sky high because the private developer can come in and they can charge whatever they want, whatever the market demands or whatever the market allows, rather. So in creating that partnership, we were looking at ways to work together to be able to ensure that they tend to be older multifamily buildings, that they have accessibility modifications done to those units because they tend to be built before the ADA. Therefore, the units tend to not be accessible because of the timing of when they were built. So it's really looking at little places where you can work with local administrators, determining how they can help. You can help with combining both, state, federal, and local resources to create an impact. One successful program that I'll talk about is a inclusionary zoning program that our agency set up with Howard County, Maryland, called the Disability Income Housing Units Program, or DIHU. This is a specific kind of program targeting market rate developers who are building in the county. There is a requirement that they build a certain number of units that serve individuals who are moderate or low income. Well, we added another stipulation to that where we were asking that, hey, if you want to fulfill this compliance requirement, could you also consider building units targeting people who have a disability whose income is 20% of the area median or less? And so that's another option. So if the developer wants to build less affordable units, but have that benefit people at a lower income bracket, they can opt in to that as a choice. And then they take referrals from our agency to fill those units. So it depends, but really, as I said, working with the different counties that have, and all of them are different, and every state's different too. So if you have areas that are higher demand for people with disabilities that your organizations are supporting or working with, collaborate. I encourage you to develop the relationships, see what the resources are, and then, in those conversations, that's where you can kind of develop new programs and figure out how to retool resources that are already there.
Thank you, Chelsea. So, Hunter, you mentioned earlier that the Kelsey also does policy advocacy as well as development. And so tell us a little bit about what you're learning are some of the policies that seem to be the most effective or the most promising that you're pushing for.
Yeah, thank you. This is definitely my wheelhouse. I work on the policy side of the organization. And so we have found, a bunch of different policies at the local, state, and federal level that would really push the needle on the supply that is lacking. And, we talked a lot about Olmstead and also a similar guideline or policy mandate to Olmstead is the Medicaid, home and community-based services settings rule that, deadlines kept getting pushed back because of COVID, but a lot of states have to put together their settings rule this year and finalize it. And one of those criterias is that no more than 25% of units are reserved for people with disabilities who need supportive services. So local funding sources should align with these mandates, and then that'll also make it so state and local funding sources can be paired with federal sources of funding like HUD Section 811 to really get that deep level of affordability in developments. And we did talk already, I know Chelsea talked about the qualified allocation plan, and this is something that we are heavily focused on this year, given that, LIHTC, the low income housing tax credit, we're all pretty deeply familiar with it, given that Shelterforce has done a lot of spotlights on the program. It is really the primary driver of affordable housing in the country. But if it's not paired with other sources of federal funding, given that it's considered a state funding source, even though it comes from the Internal Revenue Service, then they don't have to have any in-unit accessibility requirements. So they don't have to follow, Section 504 or the Uniform Federal Accessibility Standards. And so it's really important at the state level that advocates, policymakers, really analyze their qualified allocation plan, which is how states determine what developments get these tax credits, and see what requirements or incentives are included already. The Kelsey has already done a little bit of this analysis, but we've really found that most states do not have any individual requirements in their QAPs for accessibility standards. And so I really think it's an untapped area of advocacy. And each year, states release their draft of this plan for public comments, and many housing finance agencies hold workshops or public hearings, or you can email them, recommendations for these QAPs. And most of the comments that they receive are, from large, legal savvy, like housing developers and architectural firms. And so these companies are usually, more interested in adjusting rules in a self-serving way to ensure that their projects get rewarded the tax credits. And so they really need more comments from disabled advocates, allies, to tell them that they need to focus more on resident experience, the living environment, accessible design, and just to ensure that people with disabilities and older adults can live and thrive in the communities of their choosing. I think this is an excellent way to ensure that we get to the disability forward housing future that we need. And we need both requirements and incentives. Developers are really driven by these incentives, and given that this process is so competitive, they'll do anything they can to get, the extra point they can on their application. And so, like I said earlier, San Jose has incorporated our design standards to give incentives for extra points. And then also we can improve and invest in programs that we already know work but are just chronically underfunded, like Section 811, Section 202, housing choice vouchers, including mainstream vouchers, and really just aligning these all with, we talked a little bit about transit-oriented development, and really incentivizing that, as well as investing more to strengthen Medicaid HCBS, the settings rule. And then just building new programs at the local level to ensure community living. So creating new voucher programs, and then also creating a national home modification program for people who are currently left to their own accord or left to piecemeal, underfunded local support to make essential changes and repairs to their homes to make sure that they're accessible. So the future is bright. We have a lot of tools at our disposal. We just need more advocates and more, allies with, these kind of funding sources to really help us, achieve the housing future that we all deserve.
Great. Thanks, Hunter. And this just a very quick clarifying question from the chat. How often are the QAP standards revised?
Yeah, so some states, or most states, I would say, do them every year. Some states do put out a 2-year plan. I know, for example, Michigan just put out a plan that goes into 2025, and so, but some states like Georgia will allow comments at any time. They have a web form that you can just at any time in the year submit comments, and then other states do require it to be under a specific timeline of when they release the draft. They usually give you about a month to review the draft and then submit comments.
Great, thank you. Shelley, can you talk to us a little bit about, you worked on a project that was assigning some preference points to help folks coming out of institutions get priority access to certain funding?
Yes, well, I want to make people aware that your local housing authorities have to do a plan, just like just like a state plan. They have to do a plan on what they're going to do to further housing in the following year, in the years to come. I don't know whether it's done every year or whether it's done every 2 years, but I was reading the proposed plan, and it didn't show any, whenever you apply to a housing authority, they usually have a page. Are you disabled? Are you a veteran? Different things like that. And you check these boxes, and at the end they come up with a score, and that shows where you're going to be put within the waiting list. And I saw there was no kind of box to check that if you were living in an institution. Well, the Olmstead decree has, said that we are to be moving people out of institutions back into the community. And so my work partner and I and the center where I worked, we went to bat with the local housing authority, and we advocated, and we got a preference point checkbox for people that were in institutions. So immediately that moved some of the people that we were working with up on the waiting list so that they could do that sooner. And I know that many of the 22 centers for independent living across Illinois have done that, as well as I have come across that across other states, that they have been doing that. So I would encourage advocates to do that. Also, every chance you get as an advocate, when you see a chance to make public comment, and I ditto everything that Hunter just said, when you can make a public comment, please do it, because maybe you don't think that your little comment counts, but it does. It does. And if you think your comment doesn't count and you don't make it, then all they're seeing is comments that may be not in your best interest. So make time to do that. Also, please take time to partner with other agencies and organizations, because there's more power when you're together. Just like trying to partner with National Low Income Housing Coalition, but also within the state of Illinois. I'm a board member of Housing Action Illinois, and they're also partners with all kinds of housing agencies throughout the state of Illinois. And I want to say they worked very hard and just got past legislation about source of income, that no longer could landlords discriminate against what you're counting as your income, whether it be SSI, veterans benefits, anything that goes into your income. And I think it's very important that we push for this on a federal level so that we are not discriminated against. And I came across that all the time while I was trying to move people out of nursing facilities. I came across it as a person that used to rely on SSDI to get by. So please advocate, advocate, advocate. And I know that Anita has a lot to say about this too.
Indeed. We're going to pass over to Anita for a quick wrap up so that we can get to our audience questions. Anita, can you kind of give us that argument about what it would take in terms of housing availability to really comply with the Olmstead decision?
Well, this Anita, states have to take this seriously. States have to. I believe that the states, like the housing, they have to partner with disability organizations. Olmstead says unnecessary institutionalization is discrimination under the Americans with Disabilities Act.
Mhm.
So when you're setting up someone, to be unnecessarily institutionalized, you are in violation of Olmstead. If you have policies that discriminate against people with disabilities or make it further or don't like take into account people with very low income, and there are people out there, remember, with disabilities who have no income. They don't have Social Security, SSI, nothing. They have nothing. They need housing too. And so, if the states, because if the state housing and all of the other uh, uh, organizations and agencies out there, if they're not making sure that they are accessible to the widest number of people with disabilities, varying kinds of disabilities, various other situations going on, then yes, you are in violation of Olmstead. And but that can be dealt with. That can be taken care of. States, around the country are working with disability organizations and activists and with disabilities to do that, to create more housing, to create better housing, to look at different situations like situations where if you have a felony, related to drug use. In states now where marijuana is legal, you got marijuana charges, you can't get into housing. How does that work? I know of an individual who is stuck in a nursing home because he racked up felonies before he went to the nursing home, and now he is not, he doesn't qualify for the housing. Well, okay, so people may do or make mistakes and whatnot in their lives. That should not bar them from housing for the rest of their lives. But indeed it does. And so there are so many things, that could go into the state really getting up with the disability community and partnering with disability organizations to make sure that there is the largest, widest number of housing. We have a registry in New York State, for accessible housing and whatnot, different forms of accessibility, adaptability, and all that. We have that so that if you're working with someone coming out of an institution, or if you are diverting, because Olmstead also allows one, talks about diversion from nursing home placement. And that's where housing comes into our stop.
All right, there's so much to say, but I definitely want to thank you, and I definitely want to get to some of these questions, and I'm gonna pull some of them that are related together. So there's a couple questions have come up about assigning a target percentage of accessible units or units that are targeted for folks with disabilities, which may not be the same thing. But so there's one question about our Olmstead Housing Subcommittee has been unable to figure out what percentage to require for accessibility, whereas someone else is concerned that if you limit, we don't want to create segregated buildings, but also if you limit the number, we just have an overall shortage. As Anita has said, we have people on the street, and so how do we balance that, wanting to make sure that we're not creating segregated facilities, but that we're also creating as much housing as fast as possible that people can get into. So how do you guys think about that when you think about targets for new buildings? I know it's a tough question.
This is Anita. I was thinking about kind of along those lines. One of the things that we often find with housing is that um, it's segregated, and oftentimes affordable, accessible housing, particularly for people with very low income, you're relegated to unsafe space.
Mhm.
And we have a need for safe housing as well. So, we're working, with, and unfortunately, that's what ends up happening when you're poor, and especially poor and disabled. You're often relegated to unsafe spaces, and we really need to work with developers and agencies and organizations to halt that.
Hunter, Chelsea, I know you guys have worked on some of these policies where you're looking at inclusionary things. How did that process go in terms of picking target percentages?
This is Chelsea. So, I mean, primarily we go off of the what's set in the standard for the Olmstead Act and for the 25% integration mandate. There's also, someone had asked me about whether there is guidance about the number of different types of units that are built for different disability groups. So individuals who are blind or low vision, or who are deaf, or need different types of enhancements to a unit. There is specific guidance on the HUD website about those ratios. I can provide that link in the chat. But that's what we go off of. I don't know if that answers the question.
I can jump in real quick. This is Hunter. I think one thing that I've seen a lot of recent news coverage around is that the supply of, these luxury buildings do exist, like the rent for, people who can afford, more expensive, like, 100% AMI, etc. Above that units, the supply does exist. And so what we need to do is just make sure that those buildings are have set asides for people who are low income and disabled. So making sure that yes, obviously we need new buildings, we need new supply, but making sure that there's mixed income as well in these, larger luxury type buildings as well would really help kind of decrease the likelihood that people will be segregated.
And this is Anita, but there's an unintended consequence with that. Although I totally look, so I'm originally from Chicago, and I had a friend who was disabled, living in one of these luxury apartments, that they had set aside for folks with very low income. When she went to get assistance, food stamps, things of that nature, they looked at her address and said, you live there. You live on the Magnificent Mile. You don't need our help. So I think, when we do this, we do also have to partner with and look at agencies and say, look, just be aware that we do have folks with very low income living at these addresses. Don't automatically exclude them for services based on the address that they live. They may be in a situation where you got a Section 8 voucher in a luxury apartment.
That's a super important point. I have a question that is the interesting one. So we've talked about different kinds of disabilities and different kinds of needs, and one of them, folks with environmental sensitivities, so chemical sensitivities. And while, Hunter, you mentioned that the Kelsey is is careful to try to accommodate this. Some folks are sensitive enough that they feel like they need to live in a house, so not in multifamily units where they just have control over their airspace and anything that might be coming in through their door. Are any of you aware of work going on to provide independent, standalone housing for folks that need that?
This is Chelsea. I have not heard of anything, but we have had in our program, we've had individuals with different types of chemical sensitivities request accommodations, potentially either to relocate entirely to a different building, or we've had circumstances where perhaps modifications could be done to the ventilation units that are associated with that specific apartment. So at times it can be accommodated, and at other times, depending on the person's needs, it's a little bit more difficult if they have a project-based rental assistance source, like a subsidy that is tied to a specific unit versus having a voucher. Because if they have a voucher, they're able to potentially relocate to a place that works better for them, and that can be an accommodation request made, versus if they're living in a multifamily building with project-based rental assistance, it's a little bit more difficult to relocate that quickly. So I have not heard of any projects, but.
Anyone else heard of anything on that? Right.
Well, I will say that before I left Madison County, I did notice a trend more toward not buildings, but individual housing units. And there were a couple of properties that I was able to utilize, Tiffany and I, to move people out and into these individual units, with the possibility of, after so many years, the person living there had the chance to purchase that unit. So I did see a trend going on down there, and I know that we have a development here in Springfield, Illinois, that is the individual houses that we're working on, and I would really love to see more things like that. I think it's more of it feels like mine. I'm more possessive. I'm more proud of that unit because it's mine, and it could indeed be mine at the end of this, should I choose to purchase it. I just like that idea.
Thank you. So there's a couple questions here that I think are somewhat related, and I'm going to try and stitch them together. And that is, let's talk a little bit about both policies that might address accessibility if a disability is onset while someone is living in both. So this is, questions about retrofitting, and also just that point, I think it may relate back to that point about adaptability that Hunter made earlier. And then also just broadly, tenant rights issues that support everyone, but are particularly important for folks with disabilities, whether that's consistent heat and cooling, or sufficient bandwidth in your Wi-Fi in a development, or other things like that. Are there connections being made between the tenants' rights folks and the disability advocacy folks on those fronts? And I'll throw in there also, we have a question about funding for retrofits and
This
accessible.
Anita, about states sometimes have programs where they can go in and like retrofit, or like make, for example, if if you have a situation where you didn't need, you know, uh, uh, wheelchair access, but now you do, or you need a little ramp or something like that. Some states have programs to help um, disabled homeowners and folks in apartment settings to modify their homes. I don't know if it's usually the states and different programs within the states. I don't know if any of the housing authorities or anything like that have it. It's usually like separate state programs that provide that funding or that will do it for free.
Veterans Affairs also has a project that does a lot of that for veterans. Other thoughts about?
Oh, this is Chelsea. Is this in reference to the modifications, Miriam? Is that?
Yes, but you
Okay.
also feel free to weigh in on the various tenant rights stuff as well.
Yeah, so although I can't weigh in on the tenant rights piece, and sorry, I'm like answering questions in the chat that people are direct messaging me while also trying to keep up with all the moderated questions as well. So there are programs that provide through single family. HUD has an office of single family home rehabilitation programs often provide for things like ramps, accessibility modifications. That's actually how I got started in the housing space, was doing that work many years ago now. So they are typically done through deferred or forgivable loans. Occasionally they may be grants depending on income level of the individual. They are funded, typically the funding flows through the Department of Housing and Community Development for the local jurisdiction. So it could be that it comes through the state for some jurisdictions. Some others, like I mentioned previously about urban counties, larger counties that get direct HUD funding, they may administer the program. In addition, there is also allowance for a certain amount of assistance through an environmental assessment if you're an individual who receives Medicaid waiver services, or at least within our state. I can't speak for other states, but that is a service that for individuals who have accessibility needs and need to be evaluated by an occupational therapist in the home to get modifications done. It's a resource that we did a webinar on that, and I can share the link to that if people are interested.
I want to jump in here for just a second and say, first of all, if you direct message me anything in the chat, my vision is low and I'm not going to be able to see that. So don't think I'm ignoring you if I'm not answering your question. But I would like to encourage people to contact their local Center for Independent Living. Because the Center for Independent Living oftentimes know if there's grant funds available and who's doing what. So they could be a great source of information for you. I know we've got a new funding stream coming into to the Illinois Network of Centers for Independent Living here to assist people that are contacting the CILs for home modifications. And it was a great advocacy effort on the part of Illinois Network of Centers for Independent Living and their entire advocacy team, which included other advocates at CILs for Independent Living. So I would encourage you to start advocating and working with your states to get more funding for that home modification program.
Great. I want to wrap up with a question about just language. Language matters sometimes, and there's a lot of different language that we're using to talk about. Here there's accessible, physically accessible, universal design, visitable. Can you just sort of share at what circumstances you would use which phrases, if there's any of those that you don't think is useful here, or what you prefer as we talk about what we need more of going forward?
So this, Anita, I tend to use the term visitable to describe like a home that has a no-step entrance, 32-inch wide doors, um, accessible bathroom on the first floor, something that you can get, into, that you got friends who may use wheelchairs can get into the house, can go to the bathroom, and whatnot. And then, yeah, universal design. Some people use it almost interchangeable with visitable, but universal design, because with visitability, I believe that the policy is a certain percentage of single family homes be made visible. Universal design to me implies that every home, every apartment and whatnot is built to be, I would say, as close to universally accessible as possible. That they would have features that are helpful for people who are blind, people who are deaf. They'd have some environmental features. They'd have accessibility features like wheelchair accessibility, elevator accessibility, and all that. So to me, universal design means everything has it, whereas visitable means your home is, you can get into it. It's not totally accessible, but you can get into it. You can at least have friends visit. That's kind of what it is for me.
Thank you.
Yeah, I'll just plug, this is Hunter, real quick, that the Kelsey actually has a housing and disability glossary of terms on our website. I'll add the link in the chat. We have a bunch of resources on our website under what we call the Learn Center, ranging from how to make, your buildings more resident centered. I just wrote an article about the qualified allocation plan process. So I would definitely check that out. And yeah, I think language, particularly in the development space, is really hard to grasp. There's a lot of technical terms that are tossed around. And so this glossary has both, definitions of ableism, definitions of people first versus identity first language that, we talk about in the disability rights space. But yeah, also those technical terms, like what was the one I just saw that I didn't even really know? Inclusionary zoning, density bonus, regional housing needs assessment, really technical stuff like that.
Great. Thank you all so much. We will be sending out the recording, the chat. We'll make sure that you're able to follow up with the panelists if you have further questions, or with us. If you are not a subscriber to Shelterforce, please sign up for our newsletter. We send one out every Monday, and we cover housing and community development of all sorts. So please get on that list and connect with us, follow up. And again, thank you for everyone, to our panelists and to our audience, for participating. And we look forward to hearing more about how everyone is moving disability forward, housing forward. Thank you.